Morning, everyone. We're going to call the Human Services meeting to order. It is 10:06 a.m. on October 28th. Can we have a motion to approve the September 30th minutes, please? Do we have a second?
Second.
Second by Don and Jay and Lester. Thank you. All in favor?
All right.
Okay. Going down into the departments, I see Mike Gray. Are you all set?
Yes, I am.
Good morning.
Good morning, everyone. Thanks. I just wanted to give you an update on that. DSS in my office just completed the STSJP plan for 2021. That's a state plan, and STSJP stands for Supervision Treatment Services Juvenile Program. What it is, those state dollars that are used locally to address youth that may be deemed at risk. So the population served are generally PINS program youth as well as JD. So in the past, been very effective over the last 7 years, using the funds to address the issue, keep kids out of detention. And the commissioner this year saw an opportunity possibly to expand those services and current gaps that are in service delivery of providing services to these high-risk youth. Specifically, the PINS population. Our goal this year is we expanded we're proposing to the state to expand services to pre-PINS youth. So a youth that comes to, is identified as someone at risk could be referred to our office, and then we would work with the family and the youth to lessen the probability of them going further in the system, because the studies show that once a youth comes into the system, you increase the probability they're going to go deeper, which means, in essence, the possibility of more negative outcomes as well as more expense to the county, frankly. So one of the services, the pre-PINS program, we would work with the youth and look at the identified risk factors and issues contributing to them being identified as an at-risk youth, and work with the family to support them to keep that youth in the home, whether it's a biological family or if it's any form of kinship, or if the youth is even already in foster care. Every level of foster care that if the youth isn't compliant and the level is raised, the cost essentially doubles, which means the counties have more exposure, as well as the youth going into a higher risk facility. So our goal is to use state funding to meet local need. We've been very successful in the past doing that. Last month at my budget presentation, I mentioned the fact that safe harbor funding was, we were in our last year of safe harbor funding. That funding addresses the youth that are at risk for sexual exploitation, which we've had 5 years of funding developed. That it is an issue in Washington County, as in every county across the state. And there was because of the fiscal situation at the state level, there's been no direction as to whether there'll be any sustainability funding for next year. And I can't get an answer on that. So this funding stream, STSJP, allowed us to meet a state mandate, keep the program in service, and meet the needs of those youth. On average, we serve about 25 youth annually. So what I'd like to do is, in working with DSS on this, is we submitted the plan, and upon approval of the state, I'd like to bring it back to you. None of the additional dollars requested are included in my proposed tentative budget that I submitted to the budget officer and county administrator. This was worked out after the fact, and we came together to look at local needs, and this is a possible way to resolve them. Now, all the program we will be doing is evidence-based and evidence-informed programming, which will meet the criteria for, I don't want to cloud the waters too much, but possible federal reimbursement under Title IV funding for foster care called Family Support Services. And Tammy may be touching on that in her presentation today a little bit. But so there's an opportunity for, even though we're increasing the budget, and we increased the budget for safe harbor by approximately $17,000 over last year. There's a chance for enhanced reimbursement, up to 50% of that being reimbursed, which would put us under actually less than what we spent last year. I'm presenting this just as a heads up that the plan was done, submitted. Upon approval of the plan by the state, I'll bring it back for your approval and get more depth in the weeds and what the impact will be to the county. So, are there any questions?
Any questions for Mike? I want to thank you, Mike, for going the extra steps to continue this really important program in a different way, but.
Well, thank you. Chairman, there's a real need for the program, and it's been demonstrated over 5 years. And also the pre-pins concept just makes so much sense on so many levels. If we keep youth from entering the system formally, we're going to have better outcomes. And having a family, working with the family to support the family to solve their own issues and doing it in a way that's been proven, I think that everyone will benefit. So, and I want to thank Commissioner DeLorme, because honestly, when we started this process with SDSJP, it wasn't, we actually became a model for other counties on how to effectively shift detention dollars to serve the youth. So, and making them proactive dollars. So that's all I have.
Thank you. Thank you for the update.
You're welcome.
Okay, so we're going to go into, Gina's here and Tammy are here in the same room. Go ahead. Whichever one. Tammy, you're going first? No, Gina?
I can go ahead. Good morning.
Thank you. Good morning.
Mine is pretty simple today. I am in receipt of additional DSRIP dollars. And so at this time, I'd like to come before the committee to ask for a 2020 budget amendment to recognize the DSRIP funds. At this particular time, I would like to place the DSRIP dollars in the office supply line, that's .4030.01, and increase the revenue line by $409.97. And this is line .4489.09. Again, this is 100% federal dollars that we've been receiving on behalf of the DSRIP project. At this particular time, I'd like to use this money to purchase more New York Connects printed brochures. We have made this request in the past, and we used the procurement process to obtain quotes for the printing of the brochures, and we're hoping to utilize all of the funds in that manner.
Thank you. Do we need a motion to transfer that?
Yep.
Okay, would someone like to make that motion?
Motion.
Brian, and second?
Second.
Cheryl? Don? All in favor?
Aye.
Thank you.
Okay, thank you very much. Unless there are any questions for me, that's all I truly have for today.
Okay, thank you so much for all you do.
Thank you.
Yeah. Okay, Tammy?
You're mute, or I don't know why, Tammy, but we can't hear you.
Can you hear me now?
I can.
Yes, thank you.
I had the microphone on, but the lady on the phone just told me I needed to press *6 also. So I learned something new every one of these meetings. So to go ahead and start, I wanted to update you on the implementation of the Family First Prevention Services Act. This is something that's been rolling out over the last couple of years. It hasn't yet been implemented, and so I've been giving you little dribs of information, and because it is such a significant thing, and can be such a significant issue for us budgetarily, I want to be able to just give you a reminder of what it is and then tell you what the most current impacts are. So back in the end of December in 2018, we were officially advised that President Trump had signed a bipartisan budget act of 2018 into law earlier in February, which included the Family First Prevention Services Act. The act made significant changes to various sections of Title 4E and 4B of the Social Security Act with the intent to keep children safely at home with their families, and when that wasn't possible, to utilize the least restrictive form of placement appropriate for the needs of the child. Prior to SFPSA, Title 4E reimbursement, and this is currently the case as well, because it hasn't been implemented, the Title 4E reimbursement was limited to foster care maintenance, payments, and administration. The Act allows for the first time, Title 4E funds to be used for preventive services and programs. And that is something that Mike loosely referred to a few minutes ago, that right now we are going to be funding the traditional manner for us to fund our preventive services, the contract services that we use through the Youth Bureau and then alternative sentencing. That is a 68-32% split with the state, 32% being ours. But there is a potential, at least, if not a promise, that moving forward after the implementation of this, which will be in a year from now, Title 4E funds would then be able to be used for preventive services, and that means that there would then be a 50% buy-in from the federal government, and then the rest of that would need to be broken out between the state and locals. So the reforms are intended to prioritize family-based foster care over residential care by limiting the federal reimbursement for certain residential placements. So unlike ever before, they are going to time limit for us how long they're willing to reimburse us if a child is in residential care. So again, that brings it all the more relevance for the services that we work with here in county to try to prevent placement to start with, but certainly to prevent them from increasing the level of care that they're placed at. That said, it of course incentivizes the use of prevention services, as I've mentioned. So New York State had requested a 2-year delay in the implementation, so the start date now is September 29th of 21. I've talked in the past about this as it related specifically to the need for more foster homes. My philosophy on that hasn't changed. It has been that if we have more homes, the children that do go into foster care will be able to be provided much more individualized care and support, and likely then their families would be also working in concert with the foster family. They should be working together, and so I feel that would be a difference in getting children out of foster care more quickly than the current system, where we have sometimes multiple family groups of children in one foster home. So at that time, when we talked about this in the past, pre-COVID, we convened a work group and discussed the possibilities and a plan to use $30,000 that had been allocated to our county to prepare for the implementation of this act. The work of that paused with the rest of the world, but we are currently in the process of pulling together a recruitment strategy. And at this point, what I'm planning on asking for from the community is families not specifically interested in foster care, but above that, interested in becoming registered foster parents, but to provide preventive respite care. So when we reach a point where either it's a safety issue for the children, or there's an issue where the child's behavior is preventing the parents from being able to adequately care for them, rather than that sort of being left to wait until it reaches that critical mass level and the children are removed from the home, I'd like to step in sooner and have the parents have an opportunity to have their children stay in their own custody, but stay at that time for a short period of time. It's limited to 21 days in a respite home and then have the services that Mike has talked to you about expanding through STSJP, put them in intensively supporting the youth, the foster home, and the family home to be able to then reunite them within that period of time and strengthen them, and with the hopes of then preventing any need for foster care in the future. So as time ticks closer towards the implementation of the FFFPA, the Office of Children and Family Services has given us some policy changes in the form of 2 different administrative directives that were issued to us 2 weeks ago. One is regarding blind removals, and the other is a kin-first firewall. These are terms that I have heard. They've been becoming popular over the past few years. The state has lifted them up as great practice. It's things that have been implemented, practices that have been implemented in some very large counties, and the state's belief is that if we use them statewide, it will assist statewide in limiting the number of children in foster care, as well as promoting racial and social equity and justice in child welfare. So they have now told us that we need to develop and implement these processes. Some more details: the blind removal process is intended as a tool to reduce racial disparity and disproportionality in child welfare removals. We are going to have to develop a committee along with a protocol for the committee to use during the review of a case scenario that leads to a caseworker, when a caseworker is requesting the removal of a child. All demographic information must be hidden from the team members to prevent implicit bias from unintentionally impacting a removal decision. The second policy is the kin-first firewall, is requiring a first and second look at every child that's removed from their home to ensure that all steps have been taken to make their first foster placement, or perhaps the next placement, a kinship placement that's safe, appropriate, and in the child's best interest. The policy is requiring us a higher level of review than what we already have in place to verify that all viable relatives and significant adults in a child's life have been explored to achieve a kinship placement before a non-kinship placement is made. The kin-first firewall is supposed to be in place by January 14th of 21, and the blind removal process does not have a due date, but the pre-implementation phases that are listed in the directive include our OCFS regional office administering an organizational readiness assessment with us and doing follow-up training. So these are what I would easily call unfunded mandates, all being done from the state office's belief that this is what will help us prepare for the federal act implementation, and therefore preserve the funding that comes to the state. Are there any questions about any of that? Please tell me you've been able to hear me.
Yes, yes, thank you, Tammy.
All right.
Yes, Brian, go ahead.
So, Tammy, actually, it's another funding stream that should help offset costs, or do you think this is going to expand it to a way where there's really no monetary change?
What we've been told since the beginning of this is that most states are embracing this federal change because most states have not provided preventive services. New York State has a long history of doing that and sharing the cost with the local governments. So for New York State, it is a bit more concerning. It still allows us to provide the preventive services, but putting that, the timelines that they are now putting on how long children could be in certain kinds of placements, and there are a lot of other timeframes that have to be respected in this also through the courts and many other associated parts of the law. It makes it that much more difficult for us. So for us, it feels like, there's a lot of risk in the potential to lose funding, But if we do this right and we prepare for it in a way that, first of all, we have to comply with the state, as these new directives are telling us we must, but also the planning that Mike is doing alongside of me, and certainly being informed from, you know, the front line of our workers of what is really needed. Those are the things that should make the difference here for us in Washington County. So, yes and no, Brian.
Thanks for the clarification.
Else on those, that?
Yep, I know you gotta take that. Who's number 2 on this committee, Deb?
Brian.
Brian, would you take over shortly?
Thank you.
Yeah. You might just tell me, Deb, what's next on the agenda, because I don't have it.
I have backfill requests if there aren't any questions on the other information.
Okay. So, on to the next, I guess.
Okay, so I have some additional backfill requests. Last month, I asked for permission for a temporary account clerk that could be placed in our child support unit because we'd had a long-term medical absence for someone. And you gave me permission for that, and I was very grateful for that. But since then, the particular employee that owned that spot has resigned. So we still really need someone there, but at this point, I need to ask you for permission to backfill the position with a permanent person.
Okay. Motion by Jay Scully, is it second?
Second.
John Moore? I heard Darrell Wilson.
Yep.
Any discussion on that? Okay, all in favor, say aye.
Aye.
Opposed? So moved, it's headed to personnel.
Thank you. I also spoke last month about having some caseworker openings that I was holding off on. One of these has been vacant since August. Another one has come up within the last month due to someone not being able to successfully complete their probationary period. I had told you that I'd been holding them because I was not impressed with training caseworkers virtually without having in-person training. However, at this point, there is absolutely no in-person training on the horizon. But I have been advised that once that does become available, all people that have been trained through the virtual modules will then be brought into the training center and provided in-person training to strengthen the background that they had been provided. So I have 2 vacant caseworker positions. They both would be entry-level going into Child Protective Services, and I would like to request backfills for those positions, please.
Make the motion.
Mr. Beck in charge.
Thank you, Brian. And do we have a second?
Yep, Paul first.
Okay, Paul, thank you very much. Any discussion or questions for Tammy? All in favor?
Aye.
Thank you.
Thank you. And the last position that I'm going to ask for that's on the agenda, not the last position I'm going to ask for, but it's the last one on the agenda, is a social services examiner position. That's being vacated by one of our staff who previously held the title of senior account clerk. She is now joining our accounting team. So we need to refill her position as the social services examiner, please.
Move it.
Okay, does it have a second?
Second.
Okay, Don, thank you. Okay, any discussion? All in favor?
Aye.
Thank you.
Thank
Tammy.
you. And then
Go
I do have an add-on position that I had spoken with Chairman Clary about, well, communicated with Chairman Clary about earlier today. It actually just came as a result of a conversation with Terry McNall yesterday. So I apologize for the last minute nature of this. I have since talked with Melissa Fitch as well. But you may not realize, but DSS has a computer operations coordinator position as part of our staff. They have the responsibility of troubleshooting for all of our technology needs, coordinating all of our operations with the state and then foretelling us what's on the horizon that might require adjustments. Last year, it was also determined that we had more demands than we were able to meet with that one position, and so someone from IT was then outposted to DSS. So for a short period of time, we actually had 2 people handling our technology needs within our office. Our computer operations coordinator, however, also serves in the Air National Guard in the field of public health. So she was called away from military duty in the middle of March and is currently extended out now for continued duty through March 31st of 2021. So we've been relying very heavily upon IT for their support, especially with our office being back at 100% staffing levels, and it's getting more difficult to compensate for that loss. Added to that, we're heading into the holidays. Everybody in IT has vacation time scheduled as well. And Terry has asked that we seek a temporary backfill for the computer operations coordinator position. I think this would be something that could also be discussed further in the IT meeting, which I believe is the same day as personnel. So if you...
I'll do that.
Okay, so Brian's moving it to IT and personnel?
IT and personnel.
Okay. And do we have a second?
I'll second that, yep.
Thank you, Daryl. Thank you, Don.
And if that's the case, maybe, we may want IT ahead of personnel, is that? Will it go to personnel last? I mean,
We'll figure that out.
just a suggestion that we may have to look into that.
Yeah, that's great. Okay.
Thank you.
And any other questions?
I have one more announcement. We were just notified that HEAP, which is the Heating Assistance Program, is opening on November 2nd. It's a little bit earlier this year than it has been. I usually provide a reference sheet to the committee, actually to all the board members, to give you information about what the grants are that are available and you know, who meets the criteria, that sort of information. So that was just updated for me yesterday, and I provided it to Debbie, and I believe that she'll be giving it to all of you electronically so that it can be an assist for you with any questions that you might have from residents of your town.
Wonderful. Thank you.
Yep.
One question to Deb. Did we need to vote on IT?
We still need to vote on that, yes.
Okay, we're going to backtrack, Tammy, and is all in favor of the motion that Brian made for it to go to personnel and IT? So, all in favor?
Aye.
Aye. Thank you. Any nays? Okay, perfect. Thank you, Deb.
Thank you very much for your time.
Thank you. I have one question for you that I'm sorry I got called away in the middle of our conversation about the future. How do they do short-term residential? Do they reduce the age? Are they changing the long-term age? How do they do that?
Part of the act is suggesting very short-term timelines for which a matter needs to return to court, and they're requiring certain evidentiary requirements being provided. The state is also requiring a position, a new position. We have not yet worked through whether it's something the state will be doing or if it's something that they will mandate upon the counties. But there's going to be an independent qualifier who assesses the background of the child and the situations surrounding their needs and evaluates whether or not they are appropriate to continue in residential. So that is...
So more to come.
Yes.
More to come.
Yes. My hope is to avoid it altogether.
Yeah. Thank you. I was thinking that you would want to do that.
Yes.
Okay, thank you for your answer on that.
Thank you.
Okay, so do we want to go into, I saw Patty Hunt here, Public Health. Patty, are you with us?
Yes, can you hear me?
There you are.
Okay.
We can hear you.
Thank you.
All right. The first agenda item I had was just to kind of bring you up to speed on some of the COVID activities. I think it was July that I last brought a detailed report. So just to give you an idea, since our last committee meeting, it's been the month of reports. It's been the month of plans. And just to give you, I wanted to, give you an idea of how many times we're asked to commit our staff to different activities. So the first plan, one of the first plans we did was in relation to antigen testing. Antigen testing is the testing that is the point of care testing, or also known as rapid testing. And the state is heavily invested in this, both financially and from a theoretical standpoint. There are problems with antigen testing on some of the reliability, but health departments have been advised a positive is a positive, regardless of how it's attained. So as a result of our planning, our plan, because we don't have the staff, nor do we want to risk the staff we have, and putting them in a situation where they're face-to-face with positive or symptomatic COVID patients. Our plan was to share the testing with a currently stood up site at Warren County. They have been a godsend to us, and really the primary way we've been able to send people who are symptomatic, don't have a primary care provider, have issues with copays or finances. We with a written, it's called an IDR, an infectious disease requisition, can send them to that site. It's a drive-through site. And that has worked very well for us. And in thinking about utilizing this, especially in relationship to the increased business we've seen with schools, which has been incredible, answering the questions and finding places for the children to be tested, and the extreme constraints that have been put on the school districts, who are doing an absolutely unbelievable job. We thought it best to put some of that to the current testing site. If, I know there's been discussion, and we've had some planning discussions. There's a lot of complexity to standing up a testing site or sharing these kits with school districts. There's legal issues, there's credentialing issues. It has to be overseen by a provider. And since our meeting the other day, I did get clarification that the clinical provider does not have to be a nurse practitioner, but it has to be a licensed medical professional, such as a registered nurse. So in some respect, that's good news. It provides a little more flexibility. There has to be CLIA waivers, clinical laboratory or limited service laboratory waivers. Public health does have a CLIA waiver, and antigen testing can be added to it, but there's a lot of legal and logistical things that would need to be worked out related to sharing that waiver. And then reporting capacity is a concern. Any antigen test that's given has to be reported to the New York State Clinical Laboratory System within 3 hours. So if a clinic is doing 100 tests in a period of time, that 100 results have to be manually data entered, or there has to be some kind of, the way I understand it, sophisticated statistical mechanism to upload the files in an encrypted way to the state. And other resource considerations that we've tried to work through and are kind of floating are staffing. It appears that to stand up any kind of mobile testing sites, a minimum of 15 FTE. You have to have hot and cold zones. You have to have infection control. You have to have people who run the machines. You have to have medical staff who are doing the testing. And you have to have staff who are assuring safety. In addition, there's power and generator concerns. The testing machines are sensitive to humidity and temperature. They have to be kept within a certain temperature range in order to assure that the tests are valid. In addition to training the people who are obtaining the tests, And these are typically through nasal swabs, not the nasal pharyngeal that go to the back of the throat, but anterior nasal swabs. So there's power and generator, heat and lights, IT and internet considerations, and then safety and security. So there's a lot to think about, and a lot that we're going to have to be processing over the next few weeks to see how that can best take place. You do know that, and I know it's been in the news, that any schools in yellow zones have to test 20% of their staff and students, and that's a requirement. How that would be done is still up in the air. The schools have not gotten any guidance, nor have we specifically, other than what I just described as, needing, the schools would have to have a limited service laboratory license. They would have to have certain medical personnel on site. They would have to have a way to safely handle in appropriate infection control ways the specimens, and then having to upload and report all of the testing that's done within any given 3-hour time frame. So it's a lot to digest and a lot of things to consider and get in place. So we are working on that, and Chris, Chairman Clary, and a group of administrators people are helping us kind of work through those details and see what the possibilities are given our current status here at the health department. The other plan, we had to submit an enrollment application through the health department, but to the CDC in preparation for potential or maybe inevitable COVID vaccination. We have to indicate what our storage capacity is for vaccine. There are alternatives that some providers who don't have storage would have to rely on the health department for storage, for inventory, and for oversight, which provides additional burdens to us as far as keeping all of that straight, keeping all of the record keeping and all of that, not to mention having to look at standing up pods or points of distribution for vaccine administration. Our typical pod takes our entire staff. So there's considerations going forward on how that would look. We are getting some initial information that actually some of the federal installations, VA centers, and other federal medical places, as well as pharmacies, may be the first points of distribution because of their reach in communities, but that changes day to day. So I guess the biggest thing to know is we have submitted the enrollment form. We have submitted what we have for resources, and that was done in order to get us in line for however this federal vaccine effort's going to roll out. And if the federal vaccine effort rolls out, there's going to be a New York State approval process. So it's going to have to go through some sort of approval committee that the governor's form before it will actually get it in to a pod situation for residents in the state. So there's again a lot of unknowns there, and not knowing how staff is going to be required to react. We do know we're still going to be required to do our normal case investigation and contact tracing. So how we divide the staff and what our capacity levels are going to be is still something we're going to have to plan through over the course of the next few weeks. We had to do a flu vaccination plan and flu monitoring plan for the regular seasonal flu. Right now, staff here has been vaccinated. The Sheriff's Department had a clinic on Monday, and this afternoon we'll be vaccinating those who have indicated their interest through signing up in a pod. So in the midst of everything else I've been talking about, we have been required to do a drill. And this afternoon we'll be doing, it's a modified, it's not a full-scale drill, but a modified drill in the county building, in the in relationship to the flu pod that we're doing. So we'll be doing that this afternoon. Flu vaccination, that was a difficult plan. Over the course of the last 5 years, by design, the state has had health departments move people into pharmacies and to their medical homes for flu vaccine. So that was our plan, that we would vaccinate those who had, come to us and have difficulty. We would do the underinsured and uninsured. We can secure federally funded vaccine for adults. We have historically done some clinics for migrant and farm workers to make sure that we're looking at that population. Again, another way to slice and dice staff and how we're going to move people to accomplish that. Contact investigation and contact tracing. I kind of wanted to revisit that. I think there has been some questions and about how this takes place. Contact investigation and contact tracing, although they follow similar rules and processes, they're two different things. Contact investigation is for people who we believe are positive or who have tested positive. With that, the nurses here at Public Health do those initial investigations. So we either get a report from the person, we get a pause complaint, we get a report from the physician's offices who may be doing point of care testing, or we get a laboratory report. And then we reach out to those people. And the nurses have to walk people back 48 hours to determine where they were, who they were with, what their activities were, what businesses they visited, where they were, walk them right through what their activities were, so we can collect information on who may have been exposed. From there, then calls go out to those individuals who are then quarantined. The individual who's positive is isolated. Both things mean the same. They can't leave their home. They have to remain home for either 10 or 14 days. And that creates confusion as well, because if somebody is positive and symptomatic, if their symptoms are resolving and they're fever-free for 3 days, they can be released at the end of 10 days. However, their contacts must fulfill an entire 14-day quarantine. And we have a lot of confusion with families and schools on why the person who was sick is done in 10 and I'm a contact and I feel fine and I'm not. And the reason for that is the incubation period, the time it takes for the virus to replicate in the body and a person to become symptomatic. And we have seen people who have done very well up until about day 12, and then they become sick. So it's important for us to maintain those. Contact tracing is a little bit different. Contact tracing is what happens once we've identified contacts. These are people who are not sick typically, and who have been exposed. Those we are fully maximizing the use of the state vaccine contact tracing system, the VCC. And I checked, at any given day, we have between 9 and 14 FTEs assigned to Washington County from the state-run contact tracing system. Those people are making daily calls or using what's called an SMS system through phones, cell phones, or texting to reach out to people to determine if they're well, if they're maintaining quarantine, and if they have any specific needs. So anyone who indicates that they are ill, have any kind of symptoms, if they have the sniffles, if they started sneezing, if they had an upset stomach yesterday, they're popped back to our staff, who then do the follow-up to determine what their symptoms are and get them tested. If they have any socioeconomic needs, if they need groceries, if they need medication, if they need assistance with diapers or formula, any needs that family has in order to keep them in their home and out of the community, we as the county are required to fulfill. Those two come back to staff here, who then figure out what they need, do the shopping, do the picking up, and then deliver it to their doorstep. The other cohort or group that goes directly into contact tracing and they may never hear from a Washington County public health nurse is travelers. At any given time, 40 to 50 to over the summer, almost 60% of the contacts being followed up through the state were travelers returning from identified states or level 2 or 3 countries, which are basically any country outside the United States. There's a few islands and things that don't qualify. Those individuals will go directly into the contact tracing system and may never hear from a Washington County employee. That has taken a tremendous burden off the staff. So instead of having to have that additional 9 to 14 FTEs here working those specific cases, those are able to be managed by the state, and the 6 nurses here are taking care of those who are ill, taking care of school calls, taking care of student calls, getting people into testing, referring people to where they can go to have their needs met. So those are the kind of the differences. And we are maximizing, as you can see by the FTE assignments, we're maximizing that to all potential. So much so that we've been asked to talk to some other counties on how they can better use the system, because we've also had reports created for us. We've been able to coordinate with the state on getting some data that feeds into what we need to do and report every day. So that's a different, yeah. So, and also if we have contacts from another county, we can seamlessly transfer them electronically to that county. We don't have to call, we don't have to make, write out paperwork. We can just data enter it as the nurse is doing the interview and move that individual to their county of residence. Same way, counties can transfer them to us. They'll come into our queue and then the nurses will act on that. So every morning the nurses are checking positive cases, transferred cases, new contacts, in addition to fielding calls. Our daily call volume has almost doubled. We had one day a few weeks ago, we had 72 seed calls. Those are 72 calls that lead to, on average, 2 to 3 other calls. And there was a day in September, we had 123 calls just to the office for questions. That doesn't include the school liaison work. Kathy McIntyre has really taken a lead in that and is busy pretty much all day, every day with superintendents, school nurses, and parents. So those are not counted in those contact calls. We do have a school liaison we're taking advantage of. That too is a person, a 40-hour-a-week individual hired through PCG at the state level. And that we hope will alleviate some of that daily call, or she will liaison between the schools and us in order to provide that initial frontline triaging of the calls, and then work with us on what we need to do, and then the things that that person can handle, that person will handle. We hope it's a benefit to the department here as well as the schools, because that will be that person's only focus for the 5-6 days a week. There is some flexibility with that position. So if we're working an outbreak or if we're working a positive case, we can provide some assistance potentially on weekends. But that's something we have to negotiate with the state, but they didn't say no. That person will be onboarded this week. We had initial discussions and that training will commence. I think we're going to start tomorrow if everything goes well. Currently we have 9 positive cases. The positives fluctuate day to day. We have people who are finishing their isolation and new people coming on. And that has remained fairly steady. So At any given time, they've never gone away. We've always had positives. We were lucky enough to have a little bit of a dip during the summer. But since the end of August, and certainly since school started, we've seen increases and fairly steady positives. Currently, we have 109 people under monitoring. That's when I came in. We do get 2, we call them data dumps a day of positive lab reports if they're to come in, one first thing in the morning, and then the others can be in the afternoon. So we'll be looking at those again. Currently, we have 2 people under investigation. Those are people who are symptomatic, but not diagnosed. And we'll be following up with them to get appropriate testing done. About 50% right now of our contacts are travelers. We have numerous travelers. Many come directly, as I said, into the system from the airports. And those that don't, we're getting pause complaints on. So there have been several instances where I've gotten a pause complaint that my neighbor went here or there. Right now, the trip du jour is hunting in Ohio and Indiana and Alaska. And those people are quarantined when they come back. So we've been following up on those complaints. We've been following up on the neighbor complaints and getting those people into the system as they're reported. There are people who try to bypass the airport, or we've had several instances where people are coming into airports in New Hampshire or Massachusetts and then driving back. But the community is diligent, and we're getting reports of that. Many say they didn't realize they had to report, but they do. So those are a constant source of business, and also people are not very happy when they get those calls. So that's a lot. I don't know if there's questions. I'm sure there are on any one of those plans, or what we're currently doing, or how we're doing it, or what we're doing, and how the contact tracing versus the investigations work. Currently, we do have 4 RNs working. We have 1 on sick leave, but we have been able to recruit back one of the RNs who came in during the peak of the crisis in March, and one we've had that has stayed with us since March. And then we have the 2 supervisors working on this, 2 supervisory level. And then KJ and I are nurses, surprisingly enough. And we fill in the roles. KJ's worked 90% of the weekends, giving me a little respite because I'm dealing with the state. But we've been the backup for the nurses so we could have the rest of the staff get some respite. But we have had to put on additional support staff over the course of the last month because of the numbers of calls and the isolation contacts we have to make as the other nurses are handling the incoming cases. So if you have any questions about how staff is being utilized, who's being utilized where, what our needs are, how we're managing the plans, certainly feel free to ask. I'll do my best. The other thing to think about is our other programs have continued to run on a limited basis. Rabies, of course, is always very busy during the summer, actually all year round now. So we have a nurse who manages that, and our lead program, we still have children with high lead levels. Immunization, we still have been doing immunizations, particularly as schools went back into session. The requirement is if the children are in school, they have to be up to date on their immunization. That was not relaxed. It was relaxed a little bit in the last month. I think they gave about a month's reprieve so children didn't have to be excluded. So those programs continue, as does our communicable disease. We're still seeing Giardia, we're still seeing foodborne illness, we're still seeing hepatitis and things like that that require follow-up. So it's being done. it's being, to the best of our ability. We're plugging the holes as we go along. So if anybody has any questions, I'd be more than happy to try to answer.
Anyone have any questions for Patty? Patty, that was an amazing overview. Again, what you're doing over there is keeping our communities and our families safer. So I appreciate all that work. And let's hope that we can get you some of the supports and additional people that you need over there.
Yeah, it was a little disheartening. We had a state epi call, and we were prepared to told to prepare for a very dark winter. So that was encouraging.
Not good. Not good. Chris, did you have something?
Yeah, so I just want to make sure that the board had a chance to ask Patty anything they might have, but if they don't. So given what I brought up, which admittedly was a little out of cycle, but at GovOps, just to get it on your radar, we then had an incident management team meeting Monday afternoon, talked it through with the team and with Patty and KJ. So what I would like to propose is something to try to address some of the stress and limited resources that Patty was alluding to and touching on in her report. So at a high level, what we discussed is the following. Time and a half pay for all non-union hourly public health employees who work holidays and or weekends. The creation of a contact tracer title at a grade 13, which is $21.63 an hour. And what that would do is the 13 individuals, and we'll send out a recruitment to hopefully get more, but the 13 individuals who work for other departments but who took the contact tracing training, when they work for public health, there were some reasons behind it, but we wanted some parity and some consistency in what that pay rate for the contact tracing would be. So essentially what it would be is almost, and Melissa hates this, but it makes sense in Al's payroll world, is a secondary title. So if somebody is a grade 10, but they're going to volunteer and work on a weekend as a contact tracer, they would get paid as a grade 13 for that contact tracing on the weekend. So that would be the creation of the contact tracer at a grade 13, $21.63 an hour. Also, just to kind of make sure everybody's on the same page, authorization for public health to rely on those contact tracers as much as they need with the approval of the kind of home department of those employees, right? We don't necessarily want to undermine the operations of our other departments, but luckily we have such a great team of department heads here. I think if Patty and KJ are up against it and they say, I really need your staff right now, as long as they communicate with the other department heads and the other department heads say, yeah, I can make it work, I would like the board to just kind of solidify that, public health can call on those folks whenever they want, or need, not want. So the other thing that we would need to do, Patty touched on this before, that she's currently got 4 RNs that are working on it. We had authorized her at the beginning of this to hire 3 per diems, and I think she's had some and lost some, and some have come back. What we talked about is to add authorization for 3 additional per diem RNs. So that, and there was a good analogy made in the meeting, I actually missed it, but it was relayed to me. If we hire support staff, there's very limited things those support staff can do, right? They can only return phone calls, they can't do investigations, they can only do paperwork, they can't look at labs, those kind of things. If we could be successful in recruiting 3 per diem additional RNs, those RNs are kind of like a Swiss Army knife. They can do the highest level stuff that only somebody with the clinical background and the RN certification can do, and they can do everything under it. So I think after a considerable amount of discussion, the recommendation and the request from public health was to authorize them for 3 additional per diem RN. So that would be the kind of short-term staffing fix that we would be asking the board to consider today.
Are they attainable?
The only part that gives me pause is the per diem RNs. the ability to recruit those. We were able to before, and I think we might be fortunate to pick up some more. I certainly hope so.
I'll move that.
Do you have a second?
Second.
Discussion?
Yep.
Darrell,
I'm sorry, I had a question, I can't second it. Darrell second.
Darrell seconded it, and now you have a question.
So, there's a couple questions. First of all, if some of those on the 13 list, if they work 40 hours a week and then come in as contact tracer, how does that affect their time and a half? Is there time and a half overtime pay calculated in that or not?
Short answer, because in that I hear two different questions. So the first and the easier one for me to answer is that, yes, if a department, and we do have one of these, the department says, this individual would love to volunteer to work on weekends to help public health out, we really need that individual in the office their normal 40 hours during the week. So the hours that person works on the weekends will be time and a half, right? Just because we're changing titles, they're still working more than 40 hours for us as their employer, it will trigger time and a half. The thing I'm a little fuzzy on, to be 100% honest with you, is what rate they would be 40 hours on. I don't know if it's, because our weeks are not calendar weeks, our pay weeks are Thursday through, Wednesday. So the hours that technically generate your overtime are worked on a Wednesday, even though you work Saturday and Sunday. So if you're working Wednesday in your normal job title, my logical mind says your time and a half is calculated on those hours. I need to do some more investigation, to be honest with you, with DOL, if there's some kind of a rule, say that somebody's a grade 10 in their home position, and they're going to work 4 or 5 hours in a grade 13. I could foresee a situation where there's a DOL rule that says you got to pay them time and a half at the higher of the two rates. I don't know the details of that one yet. It's a little foggy, and I haven't been able to get clear answers from people. But I think the important takeaway for the board is that if an employee works their normal 40-hour week here and then works 5 hours for public health on the weekend, that will be at time and a half.
And those people who are over grade 13 who are doing the contact tracing, they'll be paid at their normal rate?
Grade 13.
So from a grade 18 coming from contact tracing, it's still be, so then your question on how the overtime is calculated is even more important. Correct. That question.
Yes. But we had to be sensitive that we didn't necessarily, that latter scenario is the least likely to occur, and there were some, for lack of a better term, morale considerations with trying to not have, not that I would because I'm exempt, but say I were hourly, right, and I volunteered to go work a Saturday, I should not be making more than an RN who's been in the trenches since March doing this and who's burning another one of her Saturdays. So if I volunteer to do it, I won't get paid. But if I were hourly, if I volunteer to do it, I should be getting the grade 13 so that RN is making more than kind of where we were coming from.
I have another question, but it's opened up a slightly different avenue. I think we followed what Patty said, what the trend we're looking at out in the number of cases of coronavirus and projected to go up. We have a staff that has currently been under fire for, since February, March. There's been discussions about how we fill some of those gaps after that. We've got some temporary gaps here, but it looks like there may be some more long-term impact gaps in terms of staffing and how we help people out. If we have vacations, other things going on, have we thought long-term about what we can do to be ready for that? Are we going to need more permanent positions, more temporary positions, more per diem? I just hear this as a short-term solution, as you said.
Yes, every point you make is very valid. We've had those discussions. The difficult part is there's no easy solution, okay? One of the problems is that the department, and Patty, if I'm stepping out of line, please just, say you're an idiot and correct me. But since February and March, the Port Department has been out straight, right? And when this first started, it was, remember, from the federal government, it was 2 weweeks to stop the spread. And when we shut down, we thought maybe 2 or 3 weeks at the most. back in March, we didn't have a good handle that this was maybe going to be an 18-month event. And so the department was flat out, and they couldn't even really think about bringing full-time staff on, right? Because you don't have enough hours in the day to do what's in front of you, let alone train new people. They lucked out in getting a couple past employees and or RNs who had some experience that helped. I think we're a little bit in the same position now, right? We need to get them some part-time or some short-term relief so that they can even consider bringing on more full-time staff. But then we have that question of, when is this really going to end? Are we just trying to get to March or April and then a vaccine is going to be out there and things are going to start to go way down? Or is this all the way through next year? I think if it's the latter, then yes, we do need to be thinking about that. If it's only going to be March or April, then I'm not sure. And maybe this short-term solution can be a bridge to get us there. The other issue is, and we've talked about this recently with public health, where we had an infectious disease control nurse position open for 2 years that we could not recruit for. We will have a hard time recruiting qualified medical staff for a number of reasons, but those problems are real. So to, I think, the question that Mr. Campbell was asking, it's not as easy as just saying, you know what, Patty and Kathy, have 9 RNs, because they may not exist or they may not be willing to work for us. So unfortunately, there just aren't easy answers to any of those questions, even though they're all perfectly valid.
Any other questions? Hi, Dan.
Hi, Sue.
Go ahead.
Couple points. Chris, back to the time and a half for non-union people on weekends and hourly. Are there going to be people that are going to be getting time and a half that are not working in excess of 40 hours? I know previous we discussed that there are some people that work 35 hours, but it's not quite fair to have them come in for a weekend and then have to work the first 5 hours on the weekend, straight time. What's the, how's that going to be resolved?
So that is a situation, and that's what we were trying to address with that provision, would be if you had a 35-hour-a-week employee who came in and worked 5 hours on Saturday, under the current schema, if they're not in the NICE contract, they would be at straight time for that Saturday. If the board were to be receptive to what we proposed here, then those 5 hours on Saturday would be at time and a half, even though they're not over 40 hours for the work week.
I understand the logic, but I'm also rather uncomfortable with paying time and a half for something that's not in excess of 40 hours. That's been the work rule for as long as I can remember, and I'm a little bit leery of lessening that. I understand the logic. I'm just not quite comfortable there yet. As far as when this is going to end, if you remember when we went into lockdown for 14 days, the chart showed that it was not going to peak until 45 days. So anybody that thought this was going to last for 14 days was a fool. It requires logical thinking to consider that this will ever end. We don't discuss death rates in Washington County. When was the last time somebody in Washington County died from COVID? Not died of emphysema at 90 years old and also had COVID. When was the last time somebody in Washington County died of COVID? We're still at 13. Is that correct? That number's been there for a long, long, long time. Nobody's talking about death rate anymore. It's all infectious rate. That's because we're testing everybody and their brother. This is my political speech. This is absolutely asinine how we are treating this. The Washington County is still underneath a state of emergency. You have this small group of people that decides things because we're still under emergency. It's never going to end. That's the end of my diatribe. Thank you.
Thank you. Anyone else? Al?
So I have 2 quick questions. The first one might be for Patty or Chris or whoever wants to field it. With your proposal, Chris, you're asking to authorize 3 additional RNs for Patty. If Patty finds an LPN that she really likes, I don't want to draw a box around her that she can't then get that person. Can we leave it a little more open to Patty's discretion so that if she can get an LPN and not an RN, and she really would like that body to help her out, can we leave it a little more flexible for her decision?
I'm certainly comfortable with that. Patty, do you?
My only concern, I don't want to draw a box around. I mean, I'm open to being flexible, but LPNs cannot assess. And
It would be-
LPNs work.
It would be your discretion, Patty.
Mhm.
I just don't want to tie your hands for success.
No,
That's-
I understand that, and I appreciate that thought process.
And then my second question, Chris, is the first part of your proposal to pay time and a half to non-union hourly employees for weekends and holidays. I could see where a contact tracer might say, hey, I'm working a Saturday for public health, so I get time and a half automatically. So do we need to be clear that it's for public health employees that are, their home department is public health?
So yes, that is the intent behind that. And I believe in the resolution that I drafted for consideration later in the day, I think I was a little bit clearer in the resolution
Okay.
language than I was when I verbally explained it. But yes, that is the intent, that if an employee in my department gets a Tuesday off so they can work Saturday for public health, you know, they haven't been straight out since the end of February. I don't know, to Mr. Happ's point, I don't know that we need to kind of go above and beyond for that. But I do want the option available for public health. So yes, that's a good clarification, Al.
And just to follow up with I don't know what Department of Labor will tell you, but I'll tell you that our current payroll system will pay the overtime as soon as they get to 40 hours. So if it's a grade 10 that works at 13, they're going to get the overtime at grade 10. If it's a grade 18 that works at the 13, they're going to get the overtime at the 18. That's how the payroll system will pay them currently. Anything that's contrary to that, we can do there's a manual process that we can change it. So we'll see what comes back from the labor laws.
Thank you. Thank you, Al. Matt?
Still looking for permission from us at some point, maybe later today, that once you get the guidance from DOL, that sort of you and Al and Patty and Melissa will put this together to make it work. That's where we're headed on this, right? Because I don't want to have, I know you don't have all the answers, and I don't want to micromanage this, but I trust you all that you're trying to accomplish something. Let's get there. But that's what you're basically asking, right?
Yes, sir. So I would ask the board to consider and hopefully approve the proposal with the understanding that whatever that proposal that's approved by the board is, we will do our damnedest to implement it legally.
And fairly and
Yes.
flexibly for the employees. And if there's an issue between employees at different grades doing different things, you guys will resolve that and try to keep it happy so we're moving forward and getting the contract tracing done.
Yes, absolutely. And if there is something that arises that's unforeseen at this point that requires the action of you all, we will bring it back to you. If not, and there's an action that we feel like we can address administratively, we will inform you as to what that action was.
I think just a little further clarification is, there should be a caveat, it may not be perfect.
We'll get as close as we can.
Right, it just may not be perfect.
The only thing we know is that there will be change, one way or the other, right? So, do we want to,
You've got Mr. Hogan with a question.
I'm sorry, Mr. Hogan?
Patty or Chris, so, I understand it sounds like it's just a very busy place right now. Is anything fallen off since COVID raised its head 6 months ago? I mean, what are we not doing now that we were doing 6 months ago because COVID's taken its place?
We're doing very little community work. We're doing very little community education. We're only doing bare bones when it comes to lead poisoning prevention. Children who have high lead levels are being attended to, but little else. We're not doing any home visits for newborns or new moms. We're providing phone consultation at the request of pediatricians or obstetricians, but we're not doing any of that new mom baby work, family education work. As far as immunizations, we have really done only the people who have no other way to get what they need, either for employment or for school or for their own safety. We are doing rabies, but we've only been able to accomplish 2 of the 3 clinics we're required to do thus far. And that was with a tremendous amount of effort by many staff members to make it work. We've gone to a low contact rabies clinic model that had to be developed, and it was a fabulous job. They're great. They're doing whatever they can to be as creative as they can to get as much out. We do have till March to do that, and there's still hope we can, but we may not be able to. We're doing, really the basic things that we have to. We're doing this drill today, which really, if I had my way, we wouldn't be, but we have to meet the metric in order to please the state and get the funding that we need for other things related to response. So doing what we have to, we're hitting the high points, but some of those other things have fallen by the wayside. Our health educator is a contact tracer, and she is a data management person at this point and has been gracious and is doing it, but none of that health education, car seat events, car seat education is done on the phone. If we get a call or a question, primarily from our community partners, we do our best to honor that. But we're not doing, what we normally do. We're not just dispensing the car seats we would normally. So there's things that have had to fall by the wayside because we can only, we have to, every day we have to prioritize what gets done first and then down the line and who's going to. So that's kind of.
Patty, have you seen any negative consequences as a result yet? And I think this kind of leads into what Mr. Half was saying, is that we've focused so much on COVID-19 due to, I'm sure it's a direction of the state of New York, but as he pointed out, the cure is worse than the disease, perhaps. And are we letting go of some of the things we actually should be doing that having an immediate impact on people in our community?
Well, from a public health standpoint, I think we are going to see adverse consequences over time. You all know from being on the committee that anything public health does, it's about a 3 to 5 year window before you either see the positive effect or sometimes the negative. And unfortunately, the negatives tend to show themselves sooner. So the lack of screening, the lack of outreach, the lack of education, new moms and babies who might have thrived, maybe struggling, we're not seeing them and we're not encountering them. So we're not sure. But I do believe there will be negative consequences and things that we just don't have time. The subtle nuances, the data and the things we're normally looking at, we're not, because it's all day, every day COVID. And you're right, every day there's a new dictate from the state on what we're to do, how we're to report it. And as I mentioned, just with the plans that have come across in the last month, there's only so many ways to divide up your staff. And my comment and concern when I submitted the CDC plan was, what am I committing to? I can only commit one FTE. Now I'm concerned that I'm committing the staff in this department in so many different manners that I have yet to find out about, but we don't want to be left off the train. We don't want to be left without resources to vaccinate our communities. We don't want to be left without resources for testing, whether we push it out to the community or whether somehow we work out with other community medical partners to get it done. We don't want to do our community a disservice, but we can only divide a person so many different ways. And that's my concern right now. And these plans are just vague enough to allow that. And we all know, and again, I'm not trying to make a political statement, but I know it is. We all know that when the press conferences happen, that's when everybody, including who I report to at the state, gets their direction. And we're going right and we're going left and then we're zigzagging. And that's why when Chris asked me a very common sense question, what do you need? I really can't tell him that. It's the first time in my career I've been at a loss. I really like to try to think ahead and forecast and plan. And the people I work with, Tina and KJ, they are of that cloth too. And we always like to come with a potential solution, but we're at a point where we're kind of at a loss. And I think this plan is to help us to at least expand and even contract if we can, to make us more flexible in meeting some of those needs. And maybe if we can attract the RNs, we can pay more attention. So I know that was a long-winded answer, but to answer the basic question, I think we will see adverse things. They could be occurring now. We're just busy enough that we can't pay attention to those initial signals, but I think it's gonna happen.
Thanks, Patty. It's fair to say you haven't had time to write a book.
No, although we could.
Our state leaders have.
Thanks, Patty. I know you think that was long-winded. I think it was very necessary for the full board to hear. I think with us meeting on Zoom and not everybody's here, we don't get the true capacity out to everybody as to what it's done to your department. So I thank you for being that candidate and sharing it with us. And thanks, Dana Hogan, for a great question, because that's all we got there.
Thank you, Brian. I couldn't agree more. Patty, thank you so much for sharing all of your daily living with us and what's, as far as the vaccines, looking at the schools. There's so much more that could be on your plate in the future. So as a board, I know we all support you in what you're doing. And does anyone else have any other questions for Patty?
We voted. We need to vote.
We had a motion, right? And we have a second, and those are positive. And anyone give? I'm sorry. Brian, do you want to take over? This is Donna, so.
Okay.
Again, thank you.
All in favor, say aye.
Thank you.
I want to say aye.
To finance to the full board or right to the full board? Because there's time and a half, should they go to finance?
Yeah,
Can you do that?
we're gonna clean everything up in finance before I make the budget presentation.
Thank you.
So, all in favor, say aye.
Aye.
Okay. Opposed? Carried. Does that conclude everything?
We have Ken Marwin to go.
Okay, Ken, you're next.
Brian, I do have some resolutions to accept some money.
Okay.
I'm sorry, Ken. What's that?
We'll always accept money, go ahead.
Okay, I'll go through them quickly. The first resolution is to recognize public health crisis COVID-19 funding in our 2020 budget. The total amount is $95,373. This will help cover some of the cost of our additional hires and their time and a half, but only for the hires directly related to COVID. We can't supplant our current nursing staff, but this will help provide some coverage there. And we're also able to use it for the infection control nurse who's currently covered under our contract. So we want to divide it some into the contingency funding. It's all divided out, but we want to accept that funding or have approval to.
Okay, motion. Moved by Jay Scally, second by Lester. Is that Lester? Tom Ward, Darrell. All in favor, say aye.
Aye.
Opposed? Carried.
Okay. I do have three more. The second one is to recognize funding from our public health preparedness grant. This is our typical preparedness and drill grant. It covers our phones and some of our equipment that we use for drills. It covers our infection control nurse staffing hours. That's in the amount of $49,625.
You need a motion? From Lester, Don. So, we'll call
Aye.
Opposed? Carried.
The next item is to recognize funding we were able to secure from our New York State Association of County Health Officials. This funding was timely and actually a real coup to get. Because we have to reserve our flu vaccine in November of every year for the following flu season, we ended up having to reserve additional flu vaccine this year in order to make sure we could cover employee clinics and additional demands from the community. This is the regular flu vaccine. In working with NYSACHO, we were able to secure $6,785 that will cover that additional purchase. It will offset the expense to the county for the additional flu vaccine that had to be ordered. And also we'll fund a project that NYSACHO suggested to provide some, hopefully we can get them, but we want to provide some no-touch thermoscan thermometers to the schools. So this funding was funding through NYSACHO in the amount of $6,785 we'd like to recognize.
A motion? Moving down Ward, Buster, second.
Second.
Darrell and Paul, so, okay, any discussion? All in favor, say aye.
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 Okay, and the final item for me is to recognize DISRIP funding.
Good.
We too got $409.97. We'd like to recognize in our budget through the district partnership process.
Thank you, Patty. Do we have a motion to?
So moved.
Yes, second.
Second.
Okay, thank you, Esther. All in favor?
Aye.
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 Okay, thank you. That's it for me.
Thank you. Thank you very much, Patty. Okay, and now we're going into other business, which we have
You got Ken Winchell.
Ken Winchell. Yeah, we have Ken Winchell. And Ken, I see you down there. Do you want to?
Yeah. Yep. Thank you. Hello, everyone. Just bringing a resolution today that's going to cover the county indigent burials. It's a process that's already in place through social services, but it's going to appoint me as the veteran indigent burial point of contact so I can coordinate, get discharges, and apply for their federal benefits and stipends to help cover those costs.
So moved.
Okay, Brian moves it and
Seconded.
second. Okay, Darrell and Don, all in favor?
Aye.
Aye. Thank you, Ken.
Thank you, everyone.
Okay. And Matt?
I have something for Ken.
Ken?
We had a previous supervisor a few years ago who would come and bring stuff to the county and say, okay, well, we got to think about that. Where'd that come from? And he'd say, well, every time we go to the stewards, somebody would hit me about that. We got to take care of this. And it happened again and again. And eventually Brian said, you know what? You got to stop going to the stewards. Well, I was in stewards about a couple weeks ago. And a guy came up to me and said, hey, listen, ever since Ken took over the VA, things have gone great. It's smooth, everything's straight out. My paperwork, I got to tell you, and we don't get pats on the back or compliments very often, so I wanted to share that with you.
Not a steward.
Not a steward, that's for sure. But he just said, you know, ever since Ken's been there, he goes, everything is working like clockwork, and he's very happy and very satisfied. He makes sure you pass that along, so that's all I'm saying.
Thank you very, very much, and I agree. I've had the same conversation.
Now I go back
So
to
thank
steward.
you, Ken.
Thank
Thank you. Is there any other business? No? Okay, I want to thank you, Brian, for stepping in and stepping out.
No problem.
Stepping out. All good, okay, and.
Do you have any good news you want to share with us now?
We, good news. I can pick my mom up.
There you go.
So,
Excellent.
it's very good news. Do we have it, and we're adjourned, right? So thank you.
Good.
Yep. Okay, Chris? We're gonna keep going too.
No problem.
The other way. Comfortably.
No
I feel like my head's all over the place.
We switching computers, switching chairs, or just gonna do it from right here?
We're going right into finance.
Yeah.
Yeah, so we're just gonna,
Are you presenting at finance or full board?
Finance.
You are. I'll give you a cup of coffee.
If you're gonna take that long. Better get some espresso in it.
yeah, you, mind if I go get one too? Brian, you're coming up here?
Sandy talked about just switching the computers around, so I guess that's what we were doing.
Okay.
We're just switching these, Sandy?
Or you could, are you leaving? No, I'm good now. Oh, you're good now. It's up to you, like, do you want me to just,
You just
you can, I'm just gonna rename it if you wanna just swap that.
Oh, I see what she's saying.
I can just rename it. You have it, Ryan, right?
No, just all up there.
Very good. Really? Yes. Thank you very much.
Everyone uses it.
Oh, that's true. Well, I think it's good to make a presentation anyway.
Yeah, I think it's coming out.
It's really, I think that, the level of emphasis that it deserves. I mean, even when it's usual. Thank you.
Okay.
You're dressed up. Now we're even on the Pink Panther bowl.
You do know you're still live, right? We are.
Well, I think there's anything good at that as well. You're not gonna read the whole thing, are you?
It's not, oh, not the diagrams.
Oh, it is.
It's not gonna read, but
Are you serious that we all got physically mailed a copy of the budget?
yes. The whole idea was to try to get it before today, but I think the balance took precedent, I think, and, which, in good reason. So you'll get them by.
Mr. Joy from the postal department said, hey, it looks like an official thing, we better slow that down. This is the presentation.
I wonder where that is.
What are you looking for?
The I see everybody got a copy of the. And you just handed it out.
He wasn't sitting down yet.
Oh. Thank you, I got that.
Well, we're waiting, what are you doing? No, we're still live, we haven't called the meeting to order yet, but still waiting on Sue's return, and we're gonna clean up all the financial stuff before we do the budget presentation. If that makes sense to you? Sure. Quickly.
So the public health staffing and the buildings and grounds budget.
And how about the other one? That's from highway.
That's what I'm at.
To Brian,
Yeah, okay.
Yeah.
does the Brian
Yes.
MOA need to go to finance too?
I don't think so.
I don't think so, because we already went through finance to authorize $10,000, that's already gone.
She
Right.
has money. She's right.
Correct.
All right,
So the only two things we gotta do is the snow blower standard purchase and the public health staffing.
Did you hide your coffee machine from Sue? She's gonna get coffee.
There is not somebody, there is none.
Oh.
Yeah, we haven't been making it lately.
No. I got these two.
Yeah, is Sue right there or no?
You want-
She's back.
Can anybody hear me? Can't hear anything.
I hear you.
Oh, I don't hear a thing. And not in,
Cassie.
nobody from the phone.
Nobody's, you're the only
Cassie, I
one
think they're
talking,
currently
Cassie.
muted right now, waiting to start the meeting.
Oh, all right, because they were talking along and then they just stopped. All right, thank you.
You're hearing voices in your head.
They sound like 2.5. It's
Go
almost like a nightmare.
vote red.
How about now?
There you are.
Hey,
Yeah,
all
I
right.
can hear.
Sorry about that, guys. Let me get it back up here. The resolution in question is to appropriate $11,600 out of general fund contingency into the buildings and grounds equipment line for the purchase of a skid steer mounted snow blower and poly sander for the back of a pickup truck for the 2020-2021 snow season.
So, second. Moved by Matt Hicks, second by Dave O'Brien, Jay Skelly. Any discussion? Jay? You're muted, Jay. There you are.
I thought that was coming through carpool, Chris. Is going through building and grounds now? Okay, all right.
It's where it really belongs. Okay, any other discussions? All in favor say aye.
Aye.
Carried.
Okay, so then the second resolution would be what we just discussed in Health and Human Services. So the proposed staffing changes for public health. This would be the creation of a title contact tracer, grade 13, which is $21.63 an hour. Authorization for public health to utilize the existing non-public health departmental staff for contact tracing as needed. The approval for public health to hire up to 3 new per diem registered nurses to help in the COVID-19 response. And last but not least, time and a half pay for all hourly, non-union, public health departmental staff who work weekends and holidays.
Okay. Moved by Dave O'Brien, second by Sue, Don, Cassie. Any discussion? I guess my question is, it came up, that were we gonna leave Patty with some discretion if she needed something else, if she couldn't get all 3?
Yes.
So up to 3 bodies, but if she can't get all 3, she can grab something of a different title. It's kind of open-ended that way, but
It is, and I agree with Al's sentiment. There's not a good way for us to do that in our system, right? I can't put on a
Right.
staffing pattern up to an RN and including all titles therefore.
if we had families, we could.
We could. So I think right now, let's approve the 3 RNs per diem. If Patty finds a good candidate who is something else, we'll
We'll
bring
come
it
back.
to you as soon as possible.
Excellent. Okay, any more discussion? All in favor, say aye.
Right.
Opposed, carried. Okay. So, on to the 2021 budget message. I know budgets have been mailed to the supervisors, but they were emailed, so some of you were able to download them, some of you probably not. So hopefully you'll get them by election day, along with your ballot. Go there. I'll get right into it. So welcome to the unveiling of the 2021 Washington County budget. All different types of work go into these budgets from year to year, but this one was as challenging as ever. The difference this year was working around COVID-19 pandemic, which made some things easier and some much more difficult. First and foremost, I want to thank our people on the front lines of the COVID pandemic, especially those people in emergency services and public health. You've done an outstanding job. A special shout out to Tim Hardy and Glenn Gosnell, and I can't say enough for Patty Hunt and Kathy Jo McIntyre. I thank Chris, Al, and the whole staff in both offices, as well as the clerk of the board. Debbie, Sandy, and Stacy deserve a lot of the credit for making our jobs easier and enjoyable. Roger Wick, Sam Hall, and Bob Henke deserve a lot of credit in maneuvering our county through very volatile situations at moment's notice. I wish to thank and congratulate our department heads on a job well done in unprecedented times. May we all stay safe and healthy, for we have no idea what lies ahead. And I thank you very much. So I'll start with easier. Our department heads did the heavy lifting right out of the starting gate. I can't thank them enough, nor give them enough credit for how quickly they went into the crisis mode to help defray unnecessary expenses due to the situation we found ourselves in as the pandemic began to close down the county and lots of other places throughout the region. One of the first things was to not add any new hires to the 2021 budget, but of course some were added throughout this year, as we just recently discussed today. Thanks to all our department heads, our county is in a better place. Thanks to you. So the difficult side has a few items that are somewhat separate and in other ways interrelated. First, we decimated our paving. So I want to thank Deb Donahue for not taking it personally and stepping to the plate to make sure we could get as much done with the money that was left available. Next, we passed a resolution to move money to keep our projected savings as we feared for the worst case scenario. Then our sales tax started to reestablish itself as we see our county online sales increase. Today our sales tax is approximately $65,000 ahead of last year. Nothing we could have foreseen as late as May. At that time, we were worried about a $4 or $5 million deficit. So the difficult part isn't the fact we turned our county around, it is the anticipation of what the governor has in store for us in the short term and long term. We could still have as much as $2 million at risk the way the state budget was written and passed. So hang on. The short-term loss of 20% of our CHIPS funding and who knows what else. We already know the towns of Granville, Kingsbury, Whitehall, and the villages of Argyle and Hudson Falls are losing 20% of their AIM funding. That was the portion that the state still controlled. So what does this tell us about the 21-22 state budget? Will we be cut as much or more again? Will we get a definite number? Or will the governor get a blank check of ours again? One assumption would be that all AIM payments that the state has been paying will now come out of our county sales tax. And with that same mechanism, does something else get taken out of the county sales tax? In the state budget, Washington County is on the hook for under $127,000 as our share of the $50 million hospital bailout. Hard to anticipate what our sales tax number can be when we're already losing $500,000 out of what we should be getting by way of our state government. We talk about shared services. Well, the governor takes our sales tax and won't look at partnering with counties, only crippling them with less revenue and more mandates. Uncertainty is the leading theme here. This brings me to the philosophy fee behind the budget. I used $1 million in fund balance, knowing that breakage and personnel expenses through various departments would usually keep us from using that money. With a strong fund balance the way we were set up, if recovery took 3 years of draining money by way of state reduced revenues, we could enhance our efforts with an average of $2 million a year and still be in a healthy financial situation while staying under the 2% cap. This year, the tax increase is about 1.66%, which equates to $567,180. Of course, we will have a lot of decisions to make if we have cuts and or bailouts in our future, but we are in a position to weather the storm. Overall, the budget has increases in expenses that are mainly in wages and $200,000 in road machinery to solidify the fund. Thanks to the diligent work of our county administrator, we were able to significantly reduce our health insurance costs and enable a better cost for the employees as well as our county share. One of the first pages in this report shows all the general fund changes. The part of the budget that went away because of the change in the fiscal environment is the funding stream for our capital plan. We all know where interest rates went. This budget contains $178,422 to our capital plan and hopes there will be enough money with this much added to the capital plan contingency to replace the roof on the Burgoyne School that we now own. So let's turn our attention to the capital plan. Lack of funding doesn't mean we don't have needs and they need to be prioritized. It also is a requirement to have a capital plan. So there are really two types of projects in the capital plan. Capital construction of large-scale replacements, such as a roof on an existing building, basically upkeep of existing assets. This would include refurbishing and or replacement of boilers, coolers, elevators, etc. Then there is new construction as standalone buildings or new additions. The DPW shop is one that is mentioned most here at our facility. We as a board need to discuss these issues and come to a consensus on priority, timetable, funding, and how this all fits in our county's success in going forward. The first question is, what should we be doing? The second one is, how do we fund it? This will be a huge challenge, but we have time to prepare and have this all vetted by the time we figure out what is in the 21-22 state budget. The biggest factor is if we need to borrow money, we need to borrow when it is cheapest. We also need a dedicated funding stream for these capital costs. In a time of such uncertainty, these are hard questions with few easy answers. This requires a short-term and a long-term plan. We need to define our goals and come to a plan that is sustainable. Chris is working with Matt Jones to come to some conclusions, and we'll break down the different priorities and scenarios at our November finance meeting so we can begin what should be a great discussion and dialogue. Some of the best news in the county right now is our mortgage tax numbers. We are on a pace to come close to $1 million in the current fiscal year, and no one's seen this coming. Our extra 0.25% finally kicked in on April 1st and has been a great addition for funding of SUNY Adirondack. We currently can ban that for 2 more years, meaning college, but at some point that would be part of the long-term borrowing. Our debt service on the jail runs out in 2023, but at the same point, that would cover what we need to pay the PV Legacy Fund. In 2022, that will actually become a regular cost to our general fund as part of the county's budget. So we have a 2-year gap to fill there. So with budget comes our taxes. As you all remember, I sent you a lot of information about our town and county assessments back in June. I'm in hopes you looked through them and got a little intrigued by the story being told by those pages. The budget decides how much money is raised. The information I sent in June told how it would be raised and what areas were paying it. I take no satisfaction that my town of Hebron can live under the 2% cap that results in an increase of about 3%, while my friends and neighbors in Fort Edward have over a 20% increase under the 2% cap. When valuations contract, that is bad for the entire county. The effect is far-reaching, and the longer it goes on, the harder it is to come back. Keep in mind that the loss and assessment in Fort Edward alone wiped out the entire growth factor for Washington County. Every other town in Washington County had a growth factor. We are a board of supervisors. We are set up to work together. As each individual town succeeds, so does Washington County. Economic development has never been more important. Our county suffers greatly when we let individual towns slide below a sustainable level. Working together, we can bring back the prominence of a town like Fort Edward. We have the opportunities in the past, and we will have them in the future. Washington County cannot afford to miss these opportunities. The year is 2020. Our vision needs to be 2020. Foresight is what we need, and it's getting harder to come by. And I thank my fellow supervisors for putting your trust in me to deliver a sustainable spending plan for 2021. So I hope you're able to look through the different pages and relish the information that's there, because it tells a lot of stories. Some you have to look harder than others. But I think we're headed in the right path because of uncertainty, but different path is what we really strive for. And as usual, I want to strive, not just survive. So unless anyone has some real questions they want to ask right now, I'm done with my report. I got day and a half. Go ahead, Dana.
Brian, thank you. When I read your thing on page 2, the second paragraph that starts uncertainty, leading theme here about the fund balance. I first read that. My first impression is I think we should be using more fund balance to decrease the levy. You say that you budgeted $1 million, but you think maybe through breakage you might not use it. Then I read it a second time. I had less discomfort. I read it the third time, and I kind of agree with it now after I read it 3 times. I think it might be wise with the uncertainty that's coming through the state to plan to try to take out the bumps for maybe the next 3 years. I think it's going to be 4 years.
Hello?
Because some trucker just went by. I think it's going to be 4 years, especially the results of the election. If Trump is elected, they're going to drag it out to 4 years. And then after 4 years, Democrat elected, will miraculously fix itself. So, but I think this is kind of a wise move to try to take the bumps out in the next 3 years. So when I first read it, I was very against it. Now I agree. Thank you.
Thanks for the comments, Dana. I appreciate that. Is there anyone else? Al Nolet.
I don't have a question on the budget, Brian, but since this is a finance meeting, I did want to take an opportunity to share some good news with the board, so I'm glad Mr. Hicks is sitting down. I finally got the very first check from Airbnb, and I'm pleased to report the check that we received for the month of September was in the amount of $11,020.84, which is a result of $275,521 in stays in Washington County for the month of September. It exceeded what my expectation was. So for an uncharacteristically one time only, here's some good news.
Al, can you remind us what the yearly bed tax is before Airbnb?
We've floated between 12 and 18, it feels like, for years now. So obviously I don't think that this level will continue forever, but I can see it continuing in the short term, and Mr. Griffith might be able to confirm that this COVID trend kind of pushes people into this world a little bit. The only downside is it does exclude any long-term stays. So, come for the foliage and go home.
You gonna add to that, James?
Yeah, to follow up on that, COVID has changed the home share rental industry, and the expectation is that you can't put the cat back in the bag. So now that people are experiencing it and like it, I expect it to continue to grow, and see even more growth out of it, and possibly other competitors with VRBO and Airbnb. So October looks good too, so.
So if we can get the other ones on board, we're good. Okay, well, thank you. Thank you. Go ahead, Dana.
Al, was that revenue just for the month of September?
Just for the month of September, sir.
Wow. Thank you.
Once again, thanks to Andrew Meter for pushing that.
And Jay Skelly, who really kicked it off at the county level.
That's true.
Very good. Well, thank you, everyone. We stand adjourned until 1 o'clock. We meet again. 1 o'clock, we are gonna have a full board meeting. So see you then.
Andrew did that first, look at it.